lines are open now.
Thanks for joining us on this Saturday as we once again settle in and continue on with our new time. We're here every noon discussing your physical, mental, and spiritual wellness. I'm your host, Scott Duncan, and we've got medical experts of places like Orlando Internal Medicine, Florida Vascular Consultants, Orlando Heart Specialists, and in studio with me today is Dr. Faisal Fakih from Florida Pulmonary Consultants and Florida Premier Research Institute. Now, Dr. Fakih has been in private practice in Central Florida since 1979. He is a triple board certified physician investigator, certified in internal medicine, pulmonary disease, and sleep medicine. He's been conducting clinical research since 2003. We're going to talk about that today. And he's the founder of the Florida Premier Research Institute, Florida Pulmonary Research Institute, both state-of-the-art multi-specialty facilities, conducting phase 1 through 4 pharmaceutical research in the Orlando, Florida area. And for full disclosure's sake, my boss for my day job, because I also happen to be his director of marketing, and Dr. Fakih, welcome to the show.
Thank you, Scott. Nice to be here.
Well, I wanted to start today because, and I had a question that popped into my head this week that I wanted to ask you on the air. Talk to a cardiologist like Dr. Ronadeve, who I mentioned before, who's been a guest on the show, and he says everybody's got a little bit of blockage or whatever as they get older in their heart, in your vascular system. Is it the same thing with lungs? It's just a matter of degree. Everybody has a little bit of something going on with their lungs as they get older.
Well, you know, we all lose lung function as time goes by.
Okay.
I mean, that is a natural history of the lung function. So, in general, it is, and that's why you cannot do as much when you're 50 as you did when you were 30 years old.
Even if you take care of yourself,
Even
you
if
don't
take
smoke.
Care of yourself, you don't smoke, and that is the athletes. You know, the athletes tend to not be able to do as much as they did. It is because of that.
Yeah, a lot of it is as much lung function as it is cardiac or anything else.
That is correct.
Okay, but there are things you can do to keep your lungs healthy as you get older.
Obviously, yeah. Then the number one thing that really we need to do, or society needs to do, is really eliminate cigarette smoking once and for all.
Right.
I would say if we could eliminate cigarette smoking, I think probably 70% of the pulmonary diseases will be eliminated.
COPD, emphysema, things like that.
Emphysema, chronic bronchitis, even great number of heart disease, great number of other type of illnesses, lung cancer, peripheral vascular diseases. All that actually is influenced by cigarette smoking. So that is number one. Number two is the quality of the air that we breathe. Mm-hmm. That is extremely important.
Pollution here in the workplace.
Either in the workplace or out of the workplace. You know, that is important. Certain types of chemicals that are used during the workplace or out of the workplace also tend to affect the respiratory system. So
okay.
There is a lot of things that society can do really to improve the well-being.
Now, but as an individual, first and foremost, quit smoking. Try not to get yourself exposed to secondhand smoke if you don't smoke, right? And what are your thoughts on the whole secondhand smoke thing? That's a big controversy.
Well, at the beginning, I didn't used to believe that much on it, but the more time passes, the more I am a strong believer in it. Especially when parents smoke in front of the small kids.
Near their
it's
children.
Unbelievable. Those children tend up to develop lower lung function than kids that were not exposed to that.
And do they have a higher incidence of asthma as well?
They do have an incidence of asthma, a higher incidence of chronic bronchial problems. And actually, what we've seen a lot is people who never smoked and have developed lung cancer, but the husband or the wife used to smoke 2-3 packs of cigarettes per day.
A long time ago, right.
A long time ago, and then the other person who never did ended up developing problems like
But
that.
it's gotten better. I mean, when I was a kid, I remember people smoked everywhere, you know, and I walk into doctor's offices as part of my job, and the hallways and the waiting rooms, if the building's over a certain age, you can smell it.
Yeah, I remember when I used to travel with my father. My father used to smoke 3 and 4 packs of cigarettes per day. And you go into the airplane, and the only time that you couldn't smoke in the airplane was during during takeoff.
And landing.
Takeoff and landing. So
Right.
he used to have a cigarette in her hand and the lighter on the other, just waiting for the thing. But literally, I was sitting here, and he was sitting by my side, and here it is, a cigarette and a lighter.
Right.
Just waiting.
Well, and the thing that always amazed me about smoking in planes was the fact that the smoking section was the back 4 or 5 rows, and everybody in front was in the non-smoking section when they started making those divisions.
Well, actually, in the divisions that, you know, what I would remember, in Colombia, the smokers had the front of the airplane at the beginning.
And the non-smokers had to sit in the back.
Non-smokers in the back, so you used to get all that smoke.
Because basically you're in a closed system in an airplane, so it didn't matter where you sat.
Yeah, and before, there was not even the division of it. I mean, people used to smoke in whatever row.
Right,
it
right.
was it. So,
And doctors used to endorse per cigarette brands.
doctors used to endorse cigarette brands, yeah.
So, well, I mean, was it the pulmonologists who figured it out first and, whoa, this is a bad thing, or was it the cancer doctors?
Actually, probably way back, the first connection started in the 40s. In the 40s or 50s, when people start, you know, adding up the high incidence of lung cancer and pulmonary diseases. I don't know exactly, you know, who would be, or you know, the first paper who came up with it, but you know, then pulmonary disease became an specialty. I would say entirely related to cigarette smoking. I would say.
Yeah. And we've recently gotten involved with the Lung Association, the local chapter of the Lung Association, and the executive director came and spoke to us, a gentleman named Eric Gray, and said, basically, if you are sitting across from a patient and say you have lung cancer, because it's the pulmonologists who find that half the time, most of the time, 87% of those people will be dead within a year, and because of why, lack of treatment options, or?
Well, I think 87%. I would say today that might be a little
high.
A little high, yeah. I think it is amazing. It is amazing right now how long we have come. I mean, still is there is a high mortality, but we really have improved quite a bit with the new
chemotherapy, new treatments.
New treatment agents.
As a matter of fact, and you know, we do clinical research at our facility, and we've got some research going on for lung cancer. We'll talk about that when we come back and some of the other trials and how to keep your lungs healthy. My guest today is Dr. Faisal Fakih with Florida Pulmonary Consultants and Sleep Disorder Center. If you're having trouble sleeping, you can come talk to us as well. And stick around for more of Your Health Matters on 540 WFLA.